Hello, I'm so happy to be here with Dr. Oates from Boston Medical Center, who just gave a talk at the Resolve New England Conference about male fertility. And Dr. Oates, I'd love to ask you a few questions.
Sure.
What do you think the greatest challenge is for men who are facing fertility issues today?
It's probably just being healthy. And one of the things we talked about in this session was just improving your overall health, quitting smoking and having a good diet and getting a good night's sleep, which is what a lot of people do not do. Certainly in this country, we don't do that well. And just living a healthy lifestyle, because that's what maximizes your body's ability to make sperm of the best quality and of the best number. So that's probably the best thing to do, is maximization of health.
Great. And if there was one thing that guys knew before they came to see you, what do you wish they knew before they came to see you?
Probably just that, actually, because it would be nice when someone comes in. It's always nice when someone comes in and they say, well, I quit smoking 6 months ago, and I quit drinking 6 months ago, and I started sleeping well 6 months ago, so that I know that they've been already paying attention to that. So now what we're seeing in their semen is going to be their new baseline. And so it's much better to work from a new baseline than to one where we have a baseline, but they're doing all these things, then they stop, and then we have to wait several months before we get another set of numbers. So it's great when someone has already been proactive and is making strides to do these kind of things, getting healthier. That's nice when they've already done that. Or if their whole life has been like that and they've been healthy, same thing. Now the numbers that we're getting and the history we're getting are going to be their baseline. We don't need to make changes. But it's always nice when you can find changes to make, because then maybe you change the equation around for they're getting pregnant naturally, which is always our goal, is to help couples get pregnant naturally if that's a possibility. And sometimes that's not something we do, it's what the couples do themselves, for themselves, I should say.
Great, and one last question.
Sure.
Do you think that men and women who are struggling with infertility know that sperm is, you can make new sperm every 74 days? Do you think this is something that is common knowledge?
Not common knowledge, but that's from the time a sperm cell commits to becoming an actual sperm, which swims with a little head and a little tail, and it's going to swim up to an egg. But you're constantly making sperm. So it's when you do an intervention, like quitting smoking, like getting healthy, that's when the next time we're going to look to see if it's reflective in your semen analysis will be 3 to 4 months later. So that's where that information comes into play.
Great. Well, thank you so much, Dr. Oates.
You're welcome.
All right.